Hello, my dear students. Welcome to the value added course on pain management. We are in the module 1 and I'm going to deal with unit 2, factors influencing pain. Already in unit 1, you must have seen what is definition of pain, what are different types of pain, and you are introduced especially for the pain, what introduction of pain is. Now in second module, we are going to see what are the factors influencing that pain. Why do two people with same injury report different pain levels? As in first unit, you must have seen that pain is a subjective experience. So definitely two different people will have two different reports of pain level. That means that pain is influenced by many factors like biological, psychological, social, etc. And understanding these factors help nursing students or nurses to provide holistic care to the patient. What we are going to see in this unit 2, it is I'm going to cover in two videos. So in this first video, we'll try to see 50% of it. I'll just tell you what we are going to say. It is first is biological factors. We can divide into four categories. That is, first is biological factors, age, sex, and cognitive development. Second category is psychological factors. In that, cognitive, affective, and coping style skills we are going to see. Then, fourth category is social factors. In that, like we have cultural factors, family learning, gender, and ethnicity. And fourth category is impact of unrelieved pain. In that category, we are going to see what are the physical effects of pain, psychological effects, social and other effects of unrelieved pain, and impact of acute pain on recovery, development of persistent pain. So we have divided the factors into these four categories, and especially what I'll do, I'll discuss initial two categories in this video, that is biological factors and second is psychological factors. That in this video we are going to see these two categories. So dealing with first biological factors. Biology means what? You must have learned this many times even in 12th standard, that biology is what? It is related to the body age. So biological factors, mainly how it influence. Age is a major factor, you can say. Infants, they have heightened sensitivity. If you see the children, they have hypersensitivity to the pain, whereas in older adults they have underreporting with comorbidities. So age is definitely a important factor in pain perception. Infants may have heightened pain, they are scared of pain, and adults they accept it very widely. Second biological factor is sex. So women are more, they have more chronic pain sensitivity because of hormonal influence, main stoicism and underreporting, cognitive development and impairment in children, brain injury or facial expressions that may affect the biological factors. We are going to see in details. We'll see first age. Now what is infant and children? They are very immature. Nervous system is not that much developed, so they get scared, they cry even if there is a simple pain. Even if you say that you are going to have injection, especially during vaccination, you must have noticed that the children start crying as they enter into the hospital or OPD. So their facial expressions, so because they have uh, immature developed nervous system, that is why their pain perception is different. Whereas when you come to the adults, they have better verbal reporting, the nature of pain, what kind of pain, whether it is uh, throbbing pain, whether it is headache, whether it is where the pain is, they can localize it, and verbal reporting is very much good in adults compared to in children, and it is influenced by lifestyle, occupation. Whereas if you come to older adults, more than 60, 70, the belief that pain is normal and they have various comorbidities. They are used to the pain. They may have diabetes, hypertension. So all the stoicism means what? It is again, you can say, uh, accepting what you cannot control, especially when you grow. The older adults, you can say the golden age, more than 70, 80 years, they know that they are going to die, and they accept what pain they are going through. So that is especially in case of older adults, more than 80, 90, they have accepted that anyway they are at the end stage of life, and then that is called as acceptance. So stoicism is mainly acceptance and believe that pain is normal. So they know that they are going to have pain, especially when they are going to die, or with the comorbidities with diabetes and other arthritis. Such conditions they arise especially when your age increases. Then biological factor, again, use age appropriate pain scales, especially you when you consider biological age factor, you have to use appropriate pain scales, especially plaque scale. Now what is plaque scale? It is mainly used especially in children, wherein you can see their face. Actual meaning of plaque is face, leg, activity, their crying, and their consolability. All these parameters you can see, and you can score their pain in these parameters. Whereas Wong Baker faces scale is different. You may have 10 faces from 0 to 10, and then by looking at that face you can mark, you can score whether it is 4, 5, 6, and then numeric scale 0 to 10. The patient has to report like in 10 numbers how much you will score, whether it is 5, 10. Depending on that you can grade the pain, whether it is mild, no pain, moderate pain, or severe pain. Clear? Next is biological factor sex. So sex means what? It is gender. So woman and men basically, and transgender also is there, but we are not considering them here in this slide. So basically you can divide into women and men. So women have more like pain perception than men. Basically they have migraines. Migraines is more common in female because it is, migraine is what? It is recurrent headache, and mostly seen in females because they have hormonal imbalances, and it is mainly related or associated to menstrual cycles. Okay, it is concurrent pain, so it is mainly experienced in female. Fibromyalgia, it is also very common in female. It is extreme fatigue or chronic body pain because of hormonal influences. It is common in women, whereas compared to men gender, they are underreporting due to cultural expectations. What cultural expectation is that men are not supposed to cry, they have to bear the pain. That is what is expected in many cultures. So that is why even if they have pain, the pain is underreported, they will not verbalize their pain. That is biological factor. Now nursing implications, especially here, don't underestimate the gender bias. Okay, that don't consider that men will not have pain. They may have. You have to consider these factors while taking care of patient, whether it is male or female or children. Okay, avoid gender bias in pain assessment. Third important parameter in biological factor is cognitive or developmental problems or impairment. Children with limited ability to interpret, okay, they have limited ability and they cannot express pain properly. Whereas elderly with dementia, this is again a developmental problem because at as the old people they grow, there are chances that they may have dementia. They may show pain as agitation or withdrawal. Because of dementia, they will get agitated. They may not be having pain, but they have agitation. Whereas neurological impairment also can alter the pain perception. And use observational tools, especially when you deal with cognitive developmental uh, factors. So you have pain scale in dementia. There are appropriate scales available, especially for dementia, for elderly patients. So you should use those tools. You can see this. This picture will tell you biological factor. It is very obvious that the children is the, you can see in this picture, the first picture is the children. Okay, under 5 child. It is a growing pain. The child is not able to cope up with the pain, the crying. Whereas in older adult, okay, that the older elderly patient has accepted the pain, and that patient is laughing, means it is smiling, accepting it very positively, that pain. That is called as biological factor. I just see that is, you must have seen in that picture, a patient A, 5-year-old child after appendectomy, crying, restless, and unable to rate the pain numerically. In that case, you can use many other assessment scales. Whereas in other, a 70-year-old male after hip replacement, quietly lying, says that I am fine despite grimacing. You can see that picture. Now next, we can see psychological factor. Till now, any doubt? You may ask the doubts. You can ask me directly also or on chat box. So second psychological factor is second category is psychological factor. In that we are going to see cognitive, affective, and coping style skills. We'll see one by one first. Psychological factor. We have seen biological first. Now it is psychological. Cognitive means what? It is related to your behavior, especially control. Patients with control report less pain. When you have psychological control, you have very good pain control and pain perception. So in that case, you may have the pain of 9 out of 10, but you may report it as a 5 or even 4 sometimes. So you have very better control. Then self-efficacy. Confidence reduces distress. So if you are confident about handling the pain, definitely you can reduce the pain perception. Then catastrophizing means what? Catastrophizing means what? It is magnifying the threat. Here it is like, you can say the pain may be actually less, but you are magnifying the threat. Actually it is what? Catastrophizing means what? You are viewing that the pain is going to be worse than you are expecting. Actually it may not be that much worse than it is expected. That is called as catastrophizing. Means what? Your view, your attitude towards looking at pain has magnified. Then beliefs and expectancies, cultural, religious meanings, and placebo effect can also have psychological impact on perception of pain. Second psychological factor is affective. Affective means what? It is again domain. Common in chronic pain, worsens disability. Depression, especially when there is depression, it worsens the disability. Psychological factor, second is anxiety. It heightens the pain perception. Anticipatory pain. When you are anxious, when you are anxious, it heightens pain perception, anticipatory pain. So it is very important to have to control your depression and anxiety during pain. Anger increases stress and muscle tension. When you are angry, you are anxious, you are depressed, definitely your pain perception is going to get affected. So these are affective domains of psychological factor when you are considering pain. Personality, especially when neuroticism, underreporting, resilience, tolerance, all these are the factors that will cause pain perception. Then the second is coping styles and skills. Psychological factor, active coping and passive coping, especially when the person is coping very nicely. Okay, the problem solving approach, relaxation, distraction, support. So when you distract yourself from the pain perception, especially you must have seen the patients, those who are undergoing hemodialysis, they may have pain during dialysis, but they keep on reading or watching television. That is a common practice. Television is there for hemodialysis patients to watch. So that relaxes and distracts their pain perception from actual hemodialysis pain. So they are distracting themselves to other things. That is called as active coping. Passive coping is what? Avoidance, dependence, hopelessness. Okay, when you don't cope properly, so you avoid, you are dependent on something, and then you are coping. Nurses role, especially in psychological factor, is what? You should teach relaxation techniques, breathing techniques, guided imagery, positive self talk are very important factors, especially when you as a nurse take care of patients during pain. You can see this case scenario again. You can see in first picture there is a patient, and second picture also there is one patient. Both of them are old patients. I'll tell you what it is, the case scenario. Two post-operative patients with similar surgery, patient C and D. First patient was very anxious, catastrophizing. I can't bear this pain. It will never stop. If you consider like that, then it is very difficult to control the pain. And that pain score of that patient is 9 out of 10. That means the very severe pain. Whereas other picture, the patient was very calm, relaxed, and was very positive that I'll improve after hip surgery or hip replacement surgery, and the reporting of that pain is only 4 out of 10. Pain is influenced by coping styles and beliefs. I hope I have given you the enough information about biological and psychological factors. So especially summary and take home message, pain is influenced by biological and psychological factors. Holistic assessment is very essential for effective pain management, and you can address emotions and copings, not only physical symptoms, during pain assessment. And nurses play very important and key role in empowering patients, especially when uh, perception of pain matters. So these factors which are influencing pain should be taken into consideration. Maybe next video we'll see other factors. These are the references what I have referred for these biological and psychological factors. Thank you very much.